Alatorre. My name is Samantha Creasy, and I'm going to be doing my informative speech today, and I'm from Hazard Community and Technical College. Hello everyone. I'm going to be informing you all today about diabetes. First off, I want to know how many people in here have diabetes. Now I want to know how many people in here know someone who has diabetes. That's everyone. Did you know that there are 25.8 million people in the United States that have diabetes? And 366,000 of these people are from Kentucky. I got these statistics from the Center for Disease and Infection Control. Diabetes is when your glucose is increased. And there are two types of diabetes. There's type 1 diabetes and there's type 2 diabetes. Type 1 diabetes is when your insulin isn't produced right. So type 1 diabetics have to take insulin shots in order to control their glucose. And obesity is not a factor with type 1 as it is with type 2. Type 1 patients are completely insulin dependent, and they're usually diagnosed before 30 years old, and is a very rapid and very early onset. The side effects of type 1 are increased urination, increased thirst, increased hunger, weight loss, and increased frequency of infections. Type 1 diabetics must take insulin, and there are different categories of insulin: the rapid, short, intermediate, and long. And some of these insulins have certain rules and guidelines as to what you can mix and what you can't mix. And you can never mix anything with a long-acting insulin. Nothing at all, no short, no intermediate, and definitely no rapid. And you can never use your syringes or needles. And I got this information from the American Diabetes Association. Type 2. Type 2 diabetics have a decreased sensitivity to insulin and impaired beta cells. 90% of all diabetics are type 2 diabetics. And most people get type 2 diabetes around age 50, most of the time at least over 45. The risk factors for type 2 are a sedentary lifestyle, when it runs in your family, you're obese, you're over 45 years old, when you have hypertension, which is high blood pressure, you are also more apt to get type 2 diabetes, and a history of vascular disease also increases your risk for type 2. The signs of type 2 are kind of similar to type 1. You have your increased thirst, increased hunger, your increased urination, and you have sudden vision changes. Type 2 diabetes really affects your eyes, and you also have recurrent infections because with type 2, it's a lot harder for your body to make up for the infection and clear it. You don't diagnose yourself with diabetes, you have to go to the doctor, and there are 3 different tests you can get done. You can have a fasting plasma glucose test, an oral glucose tolerance test, or you can have a glycosated hemoglobin A1C. All 3 of those can diagnose you with diabetes. Just make sure you go to your doctor if you have any of the signs and symptoms that were mentioned previously. Type 2 is treated with oral agents. They are not treated with insulin or anything else, and some of these are sulfonylureas, meglitinin analogs, biglinides, alpha-glucosidase inhibitors, and these are all oral agents, and you take them by mouth. And you don't do anything with insulin, ever, because that's not the problem with type 2. Diet is one of the very biggest concerns of both type 1 and type 2 diabetics. You have to maintain your diet. You have to maintain your weight. As you know, obesity is something that affects type 2 diabetics, so they really need to maintain their weight. And for your type 1 patients, for every 15 grams of carbs that they eat, they have to give themselves 1 unit of insulin. So type 1 diabetes, they really have to monitor themselves and really have to keep track of what they eat. Exercise is also something else, because exercise can decrease your glucose, blood pressure, weight. It can just decrease everything. It just helps with everything health-wise. And you must exercise to take care of yourself. You also have to have good foot care and never go barefoot. Always wash your feet and check them routinely. Thank you all very much.